This is Dr. Madison LeBlanc, and she's joining us today so that we can talk a little bit more about the application process. Maddie, thank you so much for joining us again.
Thanks for having me back. So excited.
So today, Christy and I wanted to kind of get into the application process. I know last time we talked more specifically about the CBSE and kind of what all of that entails, but the CBSE, of course, is one component of the entire application process when dental students are applying for oral and maxillofacial surgery residency programs. And so, of course, we always say this, but of course, we could probably talk for hours about the application process and get into questions that dental students ask a lot or applicants ask a lot. But maybe today we can just kind of go over the kind of scratch the surface in terms of kind of the key points of the application process.
I just want to say too that everything Maddie is about to say, she is 24 hours post call right now. So, look at her. She looks flawless. She
Can't even
sounds
tell.
flawless. You can't even tell. But
It's
I
a little
digress.
slow, that's why.
And Maddie, can you remind everyone where you are in your residency program, like what year you are?
Yes, so I am a PGY3 in a 6-year program currently. And depending on what program you apply to, the years mean a little bit different things in terms of what they're having you do during those years. So my program, the first 2 years are med school. We come right out of dental school. We go to M1 and M2. We pretty much have the exact same schedule as the M1s and M2s for all intents and purposes. And then the third year, we start a 5-month run of anesthesia and then a 5-month run of general surgery. And then we all join back up on service in July to start the fourth year. And we hop on and off of service throughout the fourth year to finish our 5 more months of gen surge. And then the last 2 years are OMFS, very heavy, basically all OMFS.
Okay, so when talking about the application process for myself, for Christy, it has been a little bit. So for you, that process was maybe
3 years
three or
ago.
three
Yep.
year ago. Okay, so not too long ago. Although maybe it seems like it was just yesterday.
It does.
But I would say the application process, it doesn't just start like, when you start interviewing or when you submit your application. A lot of what we'll talk about today, I think, starts much earlier because you have to gather all of these things for your application. So when talking about the application process, when would you say that process should start? For like, let's say your standard dental student who's applying during their fourth year.
Well, the application opens for the following year in May. So it's just opening for people who are going into their D4 years to apply. So I would say that around May is a good time to start getting all of your materials for the actual application in gear. But I will say that a lot of the things that go in the application, like externships and like letters of recommendation, probably like needed a lot of groundwork and a lot of time before that day of the application opening even comes.
And then actually, one question that I feel like we get a lot from students is, when do I need to know that I want to pursue oral surgery to be able to apply? So for example, of course, I usually always say the earlier that you know, the better, because then you can start preparing these materials for your application. But let's say there's a student and they're between a couple specialties like oral surgery and periodontics. And they're like, how long do I have to decide? When do I really need to know to be able to apply before and match into an oral surgery program by the time I graduate?
So if you're wanting to go straight through without taking any gap years or doing any internships, which I can talk about in a second, you would probably want to start doing all of these things the beginning of D3 year. The reason I say that is because externships are a big part of the application. They take some time to put together and to coordinate. And then I would say you should try to do at least 2, bare minimum. 3 would be better. And they're all 1 week at a time. So as you can see, it just kind of eats up some time. And then if you're deciding D3 year that you want to do this, you would need to study for and take the CBSE. And then you would want to start making relationships within the department for letters of recommendation, which will take some time too I think, yeah, latest would be beginning of D3. Now, if you decided later, that's totally fine. You can do something called a non-cat or a non-categorical internship year. And that application process starts after match. Programs have these non-cat positions for people who are coming out of dental school who are interested in oral surgery but haven't matched yet. And you can go work at a program as an intern for the year and then reapply during the next cycle.
If you are deciding whether or not to pursue a non-categorical internship, some people ask, what about a GPR program? What about going out and working as a dentist for 1 to X amount of years? What are your thoughts on that?
I get this question a lot too. It's not unheard of to go be in private practice for a year and then reapply. I would say if your goal is to be as competitive to match into oral surgery as possible, it would be to do a non-cat. And the reason for that is during your non-cat, you are the intern, like you're in the hospital doing all the things, taking care of floor patients, hopefully getting some OR time, getting some clinic time, taking out teeth, doing all of these really relevant things that are going to gain you skills that will be very valuable to a team that you match into. So I would really favor that.
I agree. I think everything that you said, plus, and this is not every non-cat spot, but some of them, through that whole year, you're making connections with the program director, with the attendings. They might have connections at other programs where they can kind of not necessarily get you in somewhere, but through word of mouth, through the other programs that you're applying to, speak highly of you if you're doing a good job throughout your intern year, and or even end up matching to that program if that's something that they do. If you show that you're doing a good job, you're going to be valuable to the team, and you're going to be a good resident, then they might want to just keep you, and then you just match into that program. That's definitely happened, for example, at USC. So I agree with that. That's usually my advice too, is if you want to be an oral surgeon, then do a non-cat year if you decide to apply after you've graduated from dental school.
As far as the application process, we've talked about some of the components, the externships, the letters. What would you say all the components of the application are?
I think that would be CBSE, it would be letters of recommendation, externships, things like extracurricular activities, leadership opportunities, all those things that would go inside of your CV, which is basically, I didn't know what a CV was before dental school. It's basically a giant resume of everything you've ever done. It's not like a little brief version like a resume is. It's exhaustive. And then class rank / GPA.
Would you say in that order?
In terms of importance?
Yeah.
I think, ooh,
And the essay, too.
Oh,
Essay.
yeah, personal statement. Yes, thank you, personal statement. That's tough. Ranked
I know.
in order. I think CBSE is probably the most important because it at least gets your foot in the door. I would say CBSE, class rank / grades, letters of recommendation, and then probably like your CV, other things you've done, which includes research, and then probably personal statement.
Externships. Oh, okay.
Oh, externships.
Yeah.
It's all important.
I know it's hard. It's
Yeah.
hard. But
I think essay is last, though. Personal statement's last.
Yeah.
Totally agree. I always tell people that the number one thing is the CBSE. The tough thing, though, is I tell people the CBSE is not going to get you matched. The CBSE is going to get you interviews.
Yes.
And don't quote me on this, but usually I'll tell people, I keep saying patients, tell people that if you score incredibly highly, like you knock it out of the park, your CBSE, you are going to get a ton of interviews regardless of what else is on your application. As long as it's pretty standard and nothing egregious, you're going to get a lot of interviews, and just by the statistics, you're going to match somewhere. As long as, again, during your interview, you're not doing anything egregious. But the CBSE itself isn't going to get you matched, but it's going to get you interviews, and that will get you matched.
Yeah,
So-
once you let your personality shine, then you'll match.
And I think if we're counting the interview as a part of all of this, as a part of the application process, it would definitely be the most important.
Yes.
That's
yes.
true. That's true.
Letters. When should someone start looking for letters, and how many do they need?
I think you should start building relationships for letters as early as possible because the longer amount of clinical contact that you have with a person, the more personalized they're going to be able to make this letter for you. And the more personalized and interesting to read a letter is, and if it seems like they actually know you, I feel like they're going to factor that letter in more than something that's really generic. So, as early as possible, start making the connections. I would say the application opens in May. I think it's appropriate to ask for the letters around that time and then give the letter writers several months to write it and upload it into the system. And I think most application deadlines are somewhere in August. So if you broach the topic in May, give them a few months to do their thing and upload it and everything, then you'd have it in time. And what was the other question? I'm sorry.
I want to
How
say
many?
I asked really early. I want to say I asked in January so that they would have it when the application opened because I am not a procrastinator. I like
Yeah.
I like when that application opened, I was like I want to get everything in. So I think I more had mine ready for the May. And even then because I asked early, I don't think I got like some of my last letters until maybe like June or July. So in my heart, I was like, "Oh my gosh, I'm late." But
Yeah, no,
uh
you're early for sure.
Yeah.
But I think it also depends on if, like, what your relationship is with these people. Like let's say a program director, you're asking for a letter of recommendation. Maybe you're doing an externship at your home dental school program, and it's not until May. So you don't want to ask until you've completed that externship. I think there is some strategy to it, or you know that you're going to be working with them more closely because you have an oral surgery rotation, something like that, or you're going to give a presentation to the department, something like that. Then I think it's fair to wait until that is done so that you can ask when those things are fresh in their mind. But if it makes sense to ask earlier, at least to ask the question and then remind them again in May when the application has come out, I think that's fair. But I think we were asking who would you ask and how many people to
Yes.
ask
So
or are required?
yes, you're allowed 5 letters. I
Ooh.
would, I think you are required to have 3, but you're allowed to have 5. As far as a strategy of who to ask, the way that I was taught is that you should have the program director in the chair, and then you should have another academic OMFS for your third. The other 2 letters, if you can have other OMFS, specifically like some academic OMFS, then that would be a nice look. But if you have relationships with like research mentors or like a clinical instructor, then the last 2 letters are kind of extra. And if you feel like they really know you and can speak to you on that type of personal level than somebody who you've only met once or twice, then that's totally fine.
No, I think when I applied, so it's 3 to 5 letters of recommendation. I think when I applied, there were letters of recommendation, meaning a full letter that they write out. But then also, I don't remember what they called it. I'd have to look it up. But like slots for 3 to 5 other people to just write quick, like a small comment. Do you know
Yeah.
what I mean? I
Yeah.
think they've done away with that though, and now it's just a letter of
And they
recommendation.
had to comment on certain.
Yeah, like your communication skills, like rank it 1 through 5 or something like that.
I think they still do that when they get the invitation to write the letter. They have a letter and then
Oh,
they also submit comments on specific areas of the
okay.
student.
Okay, but I agree with you. If you are, let's say, I think maybe you can speak to this, Chrissy, because I was at UCSF, so there was a residency program, so there was opportunity to ask a letter of recommendation from a program director, a chair, other academics, but then maybe at UNLV, the landscape was different.
Yeah, at least at a program that doesn't have an oral surgery residency, they will still have an oral surgery department because it's an area of dentistry that you learn in dental school. So there's going to be an oral surgeon who's head of like the oral surgery department, or he's the head oral surgery professor. And so mine at UNLV was Dr. Orr. So I spent a lot of time with him. We went to the OR together. Actually, when you were a resident and you were visiting Las Vegas, we went to an on-call mandible fracture together.
I
That was
remember that.
cool. Yeah, that was cool. Yeah, so we spent a lot of time. I went to the OR with him. It was great. So yeah, I asked him for a letter, and then the oral surgeons that I shadowed out in private practice, I spent a lot of time with them, so I got letters from them. And I want to say, yeah, maybe my PD, not my PD, my yeah, like your row instructor.
Yeah.
Yeah. For externships, you briefly mentioned, but you recommend 2 is minimum, 4 is kind of the most. I have heard of some students doing 5, which to me seems like overkill. I think you could spend your time doing other things.
I mean, I think it depends on maybe how much time, like some people don't get a lot of time from the dental school to do that, or just the way that the curriculum is structured, it's very difficult. I think if you can do more, then that's great. And obviously there's more talking points perhaps and more that they can see that you've dedicated to oral surgery, but I don't think it's necessary.
Yeah. Any tips for the components of a CV, or any just general tips that you've noticed are good CVs and bad CVs?
I think there's a delicate balance with a CV of keeping some things on that you did in undergrad that were interesting and exciting, and then maybe just making the decision to take some things off. Like, I'm not in any way saying that the 1 hour that you spent at the food bank volunteering in undergrad was unimportant. That's wonderful. But, like, you probably don't need to have that one on there just for the sake of fatigue of, like, reading your application or reading your CV, rather. I think that you should try to have it structured with things like GPA, CBSE, rank, all kind of at the top is just a little introduction. Obviously, where you go to dental school, where you went to undergrad, what your degrees are, and then your externships should go on your CV. You should also have a section of your CV that's like a bibliography of any research that you've published or been involved in, and just a little description of the research project, what your role was. And then I would also say making sure that you highlight in your extracurriculars that you list anything that was a leadership position, anything that you took initiative on, things that have to do with oral surgery, like if you're in the Oral Surgery Honor Society at your school, if you have one of those, the Oral Surgery Club president, all of those things. And then pick and choose things that might have been really interesting from your undergrad experience if you feel like something was really important.
Yeah, totally agree with you. And it's kind of hard because, some of those things you might be attached to that you did in undergrad. But I think at the end of the day, you don't need to stress too much about those things, because now being on this other side where we have participated in interviews and reviewing applications for oral surgery applicants, when you're going through the CV, at the end of the day, they're trying to decide if you're going to be a good resident and a good fit for the program. And unfortunately, I think a lot of people will look through those things and not discount it, but not value some of those things. Like, I do agree with you though, when they go through the application, they're looking at your scores, rank, honors, are you going to be able to pass medical school, for example? And then how much exposure do you have to oral surgery, so that we know that you know what you're getting yourself into and that you really want to be here. They're not really going to sift through, again, like you said, the hours that you volunteered, or even some of the leadership positions that you've had. And so I don't think those things are quite as important. Maybe for other specialties, but for oral surgery, I think actually it's pretty simple.
I do believe at the very end of the CV, with just a very small amount of space dedicated to it, that you should put special interests if they are interesting. Maybe if it's just something really basic, don't put it on there. I have a dog. Okay, leave that off.
Yeah.
But we've gotten some really cool applicants that are oh, I used to own a bakery and I'm like a
Yeah.
professional baker.
Hmm.
Or like, I used to be a DJ and I owned a bar and I'm cool like that. Like, we love that. At least it's not going to get you an interview. It will not get you an interview. But once you get to the interview, that at least in the resident room, that's all we wanted to talk about. Like, okay,
Yeah.
let's talk about how you
Well,
used
and
to be
that,
in the Air Force and you flew planes.
and it shows that you're a human being with
Hmm.
other interests other than oral surgery. There's different dimensions to you. Like, I'm sure, Maddie, for you, did you put your equestrian interest and passion
Yeah.
in your application? I would imagine that you
Yeah.
did.
Yeah, I did, and I structured pretty much my whole personal statement around equestrian and stuff too. But another thing that I put in there that I thought was kind of random, but something that I liked that I actually got asked about a lot was I hesitate to call myself a makeup artist, but like I've done makeup for
Oh,
weddings and stuff and have gotten paid for it and
ooh.
stuff. So I guess maybe you could call it
Wow.
that. I have an
Yeah.
interest.
I would definitely call it that. If you're getting paid for, if people are paying you, that means you're good.
Yeah,
Yeah,
so
you're
I put that
professional.
on there, and a surprising amount of people asked me about that and stuff. So
That's so
yeah,
cool. Yeah, but see, it shows that you're like a real
Yeah.
yeah,
person and that you're not
You're
just
not just a gunner oral
numbers,
surgery
yes,
yeah, on a
applicant.
page. So, okay. Well, that is really interesting. That's really cool. I guess from there, we can talk about a little bit the personal statement. I think a lot of people really get stressed out about this because some people are like, I have nothing to talk about. How do I make my interest in oral surgery sound interesting? Also, at this time in our lives, it's been a while since we've all written like a formal essay, especially about ourselves. So maybe that part of our talent and skills that we used in college is not there anymore. And so I think a lot of people really stress out about this. What are your
Maybe we never had that
Yeah,
talent to begin with.
I know. What recommendations do you have for the personal statement?
I think well, just really basic things. It shouldn't be more than one page, 12-point font, single spaced. So you do have pretty limited space to work with. One of my mentors, really, I truly credit the idea to her and how she framed it, I think is wonderful. And I try to pass it around to people. And the way that she had me approach it is think of a life experience that you have or something that's special about you that illustrates qualities that you have that would make you a good resident. So I mentioned that
I
I
like that.
structured, yeah, so I structured the whole thing around equestrian and the barn that I was raised in. It sounds crazy, but if you fell off, we're calling an ambulance or you're getting back on. Like there isn't an in between. Like you're gonna do it.
That
So
sounds just like
Yeah.
residency.
yes,
Yeah.
It
right.
literally is
So
residency.
so not being afraid of failure, failing and having to do things again, the physicality of it, the team environment of it, and the progression of as you get older in competition barns, you often become a mentor to the younger riders, helping do things. I threw in, I actually used to braid all of the horses, the manes and tails for our competitions and stuff. So threw in like a little like hand skill thing,
That's
that I
so
used to do.
cute.
And I structured it in that way, and I got some really positive feedback about that. Just another example of it, one of my mentees, who's a friend, he had a very, very successful match cycle and is now in Florida, and his was all centered around being a college gymnast and like all the qualities of through doing all of like that experience, how that will make him a good resident and a good teammate. And I feel like if you approach it from that aspect, you're not going to just be listing off your CV, which is super boring to read when your CV is directly behind it in the packet. And then you're also showing instead of telling. So you can imagine from somebody's essay about college gymnastics, like, oh, this person's really dedicated. They've invested a lot of time and energy into something. That would make them a good resident. This person it has failed a lot of times and continues new skills. That will make them a good resident. That type of thing.
Yeah, I think that's really interesting. I kind of want to read your personal statement because I
No.
bet it is really interesting.
I
I
actually
think
posted it the other
you
day.
did? Okay,
I did.
I'm gonna go read it. I'm gonna go read it. That sounds so
Yeah.
cool.
Okay, we're
But
gonna go find it.
yeah, I'm gonna read it. But I think that's all really good advice. Me thinking about when I was writing it is tough because you, Maddie, are so cool. Like you have cool interests. I'm boring. So, like your friend who's a college gymnast, I remember racking my brain like I am so boring. Like how do I communicate my passion for oral surgery and that I really, really, really want to do this and I want to be here and I want to be a part of this team. And so my advice, if you're more like me, like kind of boring and like feel like none of your life experience are worth talking about.
Well, that's all your point of view, but there's a lot of people that feel the way you feel, even though it's not true.
Well, my approach was I think I had and I haven't read mine in a really long time, but was to go and just think about more like little day-to-day type things that were interesting in the day, like not interesting in big picture, and to tie them all together, same thing, and related to oral surgery or the traits that I have that would make me a good resident or team member, and to show that I really, really am passionate and dedicated about it. But that was kind of my approach without giving specific details because I haven't read that in a really long time. But it definitely wasn't as cool as yours, even without reading yours.
Yeah.
But that's really interesting. What do you remember what you talked about in your personal
I
statement?
kind of remember. It's so cliche. It's like looking back, I'm like, oh, it's so cliche. But actually, I did get comments from a few attendings that they actually did like it. So
Yeah.
well, because I really just talked about how I truly felt, like no cap, no lie, like truly felt. So my very first externship was actually at University of Michigan. And I really talked about how I was such a bad extern. I put this booty on my head. It was so stupid. Like I tried. I wasn't bad. I tried my best, but I was a fool. And that's why I say it was bad. But I had never been to the OR before. Like I don't recommend doing that on an externship. But I had never been to the OR before. The very first OR I ever stepped into, the patient was already having surgery. Like they already
started.
the access to the surgical site had already been started. You know, I had never seen that before. So and they're covered, they're draped. So there's only the sterile field and the surgical site that's exposed, and everything else is covered. So you kind of don't realize like that's a person. Like I mean, it's weird to say, but like you don't even see like their body. You just see like a little flesh, and you don't realize like, oh, it's a person. And then we were rounding on this. It was like a cancer resection. So then maybe like 6 hours later, we're rounding at nighttime, and I met that same person in the room, and I just couldn't believe, like, oh my gosh, this was the same person that I saw in the operating room who was like lifeless, intubated, being cut open and having their cancer removed. And then like they're in bed, they're awake, they're smiling, they're thanking the surgeon and the fellow that was there. And their family was in the room. And I talked about how it was like suddenly like lifeless to this like life-filled experience. But it was like kind of backwards. It was something like based around that it just really blew me away, and I just couldn't believe it. Something like that. I talked about that. Yeah.
But see, I think for people who don't have an experience that, or like a hobby or a talent that they can talk about, even that, like for you, it was such a monumental moment. But imagine for like the intern that has scrubbed in on this case a few times already, it's a different experience. And I think if you just find a way to communicate that through your personal state, which is really hard because not everybody is a writer.
To talk about an externship experience on a personal statement is very risky because you know everyone's doing it. Like, I think we've read so many essays about it, which is you got to make sure that you word it right and that you're happy with your words if you choose to do something that's been done before, if that makes sense, if you know what I'm trying to say.
I think also having people review it.
It could be boring, I think, is what I'm saying is you risk it being very boring and being in the crowd.
Yeah,
not being unique.
I do think at the end of the day, the personal statement is not going to break your application.
I do think it's the least important component of, that's my personal opinion, but I think it's the least important part.
Yeah, it's a really nice area to show some individuality and bring a little bit of
Yes.
spirit to your application and maybe make you more memorable, I think. And
It
I think
can
it,
make you memorable.
yeah,
Yes.
and I think it's a good way to kind of screen like can you put some thoughts together and can you kind of like articulate that you actually do want to do this, you know? But
Yeah.
I
I guess
agree.
if your application is maybe on the weaker side, then you got to hit it out of the park.
Yeah.
Definitely.
Maybe.
Yeah.
Say, okay, we've submitted this part of the application. When do when would a student start hearing back from programs about if they were invited for interviews? When does that start? And then let's just like talk about the interview process because it's very unique.
Hmm.
Yeah, so normally the deadlines vary by program, but typically they're anywhere from July to end of August, that type of time frame. So when you get your application, you have to kind of look through and make sure you know when the deadline for each individual program is so that you can apply on time. But from there, the first interview invites tend to start coming out around October, I would say, or September, maybe. And then they kind
Yes.
of
Yeah.
file in through the fall. And then interviews are normally between like mid October to end of December, I would say. Like, those months are pretty busy for interviews.
Yes. At all of our dental schools, because we all went to different places, did the dental schools allow you a certain a lot of time to take off for interviews? Because I really had to structure mine to where I really could only go to 10 and I was hitting a like if you miss a certain amount of days, your grade automatically goes down in clinic.
Oh,
So I definitely took a grade hit,
that's
for
interesting.
that.
Yeah,
But
no.
at that point, it didn't matter for interviewing and
Yeah.
applying because like I'd already gotten the interview, so I wasn't really bummed out about that.
Yeah, no. I think at UCSF we didn't have anything like that where if you miss a certain amount of days, it was just up to you to make sure that if you're missing a specific rotation that you find the coverage and or uh, to switch your rotation so it's not like let's say I'm going on my peds rotation
Hmm.
that I make up those days somehow or switch with someone so I'm not missing those days. Um, and or of course you're getting behind in clinic so a lot of people would try to get requirements and whatnot done before the interview season so that if they miss a certain amount of time, they're not playing too much catch up in the new year. Like some people got a lot of requirements done before interviews or just played catch up afterward, but otherwise they wouldn't like drop us a grade or anything like that. That's crazy.
What about you, Maddie?
Yeah, it's crazy because this part of it I haven't thought about it in a while, like what I actually have to
Yeah.
do. So I seem to remember, so I went to dental school at Michigan, and at Michigan we do these external rotations during your last year. And I remember that I specifically asked for an external rotation that instead of going and spending 2 weeks at one time in Traverse City, that I got one that was 6 weeks long and it was only Tuesday, Thursdays. So it was more of like a continuity one instead of a block of time. And I justified it and said, I'm hoping to interview and I think this might give me more flexibility. And they gave it to me. So I tried to plan ahead for that. And then I tried to switch rotation schedules with other people to try and make my fall as light as possible. And then, like you guys were saying, kind of just trying to front load my clinic responsibilities, make sure my patients were like really well taken care of and got as much of their stuff done as they needed before I was maybe going to be gone for more days than expected.
What would you say is the standard or average number of interviews that people go on? Let's say if they have a strong application.
I think if you have a strong application, you could probably expect, depending on how many places you apply to interview at like maybe 10 places. That's probably a pretty good
Maybe
number.
10.
Hmm.
I can't remember the
I
math.
don't remember.
Somebody's done all the math with this match
Oh,
algorithm.
really?
And if you did, I think if you get more than 6 interview offers, then you have like a 90% chance of matching somewhere or something like that. I might be totally making that up, but it's a high amount, it's a high number.
I remember that. I think most people, if they had the opportunity and the invitations, then they would try to go on around
Yeah.
10.
So accepting the interviews can be tricky. because most places will only have one date that you can attend, so you have to be able to get that date off, or they might have a couple dates and you have to figure out the timing because if there's another program that is more desired to you and that the dates fall on the same day, if you accidentally accept a date here or there, you might be canceling out your ability to go to the other one. So that could get very tricky. Any tips for navigating how to accept these interviews if you're fortunate enough to get a ton?
Yeah, I think that I started turning interviews down or making the decision of this place is more desirable to me than this place when I was in the zone of I was very fortunate to get a lot of interviews, and I was probably around the zone where I had 7 or 8 accepted that I was like, okay, I don't need to be like taking all these places. I need to just prioritize a little bit. So I think you really just have to start to think about what you want and be really realistic once you start getting these offers if you could really see yourself at this place or not. Because if you have a limited amount of time, it's not really in your best interest if there's no way you want to move across the country or whatever to go to this interview and spend time and money and resources to go and talk to them. I will say too, as this process plays out, people are going to start making these decisions and choosing one place over another. So then the application invites kind of roll in that way. Like more waves of invites will go out as seats become available and it's kind of fluid.
I did have to make that decision in the date that I had an interview date in New York, and the very next day was the USC interview. And I was worried that something might happen to the flight, because of course the interview, it finishes late in the night because there's usually a social event after the interview during the day. So your flight would be at nighttime for me to get to Los Angeles to go to USC. And so I was like, I really want to go to USC. And so I ended up not going to the New York program. I let them know I didn't just like not show up, but I had decided, okay, I have to cancel that one. I'm not going to risk the flight being delayed or not making it because I was just trying to increase my opportunities.
I think at the beginning, you're just excited to get these interviews. So you're just accepting.
You're like,
accepting.
what? I got interviews?
They want me. But then like you said, as you realistically go through it, you're only going to go to one program. So as you go to interviews and you're like, okay, I've gone to 6, 7 interviews and you're getting more offers because some programs interview later, let's say December, then I think it's usually the later ones that you start either cutting out or if there's overlap, then you have to pick one. So if you're in that category, then you're doing something right and you will most likely match, I'm sure, as long as, again, don't do anything egregious on the interview, but you'll probably be fine. I think, and then on the flip side, if you're not getting 10 interviews, that doesn't mean you're not going to match.
Right.
Again, if you rank one program and you match there, then you only needed that one interview. And so not to say that if you only get a few interviews or less than 10 that you're not going to match, but if you did get like 5 interviews, you should go on all of them.
Yes.
Even like 5 to 10. If it was me, I would go on all of them because I want to maximize my chance of matching. We talked a little bit about this, but where you said that a lot of these interviews do have some sort of social event. So usually the interview is structured where it's like throughout the day, let's say several hours, and every program is a little bit different, where it's formal interviews, and then there's also some sort of usually social event, whether it's a dinner, a happy hour. But can you talk a little bit about the general structure of the day for these interviews?
Yeah, it depends on the program and how they structure it. But normally, I feel like a lot of interviews that I went on were almost like multiple mini interviews. So there would be like a room with an attending, a resident room, another room with an attending, and they'll all kind of like focus on different things or just kind of chat with you. there's some structures that I've heard about where it's just you and like 10 people in one room, like all the attendings are in one room and stuff. So it just depends, but you'll kind of go through all of the rooms or whoever they want you to talk to. And then a lot of the times there will be a break for lunch. They'll give you a little lecture on their program, what they have to offer, what the structure is like, the types of things that they see. And then you'll go and finish your interviews. And then from there, you'll go on a social normally, or the social's the night before. It kind of depends. It's normally either the night before or the night of the interview. And a lot of the times they'll take you out to a nice restaurant or a place with an activity or whatever to have some drinks and apps or dinner and just get the opportunity to meet residents. Sometimes the socials are only residents, that's how ours is. And then sometimes it's residents and attendings so that you can just I think socials are really valuable for an applicant, not only to be able to showcase just how you are not in a scary, stressful interview situation, but also to observe how people interact with each other. Like watching how the residents hang out with each other. Do they seem like they're friends or not? How the attendings interact with people. I think it's really easy to get the vibe of a place when you see them in a situation like that and not in an interview room. So you should really try to go if you can.
Definitely. Yeah. And then how long are these interviews typically?
They normally last the whole day. I
Or I
think,
guess like the individual rooms. My experience, it was maybe 15 to 30 minutes per room. Is that
yeah,
kind of
probably
how
yeah,
it was
like
for you?
15, 20 minutes, I would say.
Hmm.
I found average, usually the actual interview portion of the day was quite small. It usually wasn't the whole day. It's like you said, it would be information about the program. There's usually a tour, the interview part. There was only one interview I went on where it was legit the whole day, and it was so I was so tired after.
Uh,
Yeah, yeah.
but that is true. Sometimes the social is the night before, and so that can complicate things if you have certain travel plans or you have other interviews kind of nearby. And so I would recommend, especially, of course, if it's a program that you strongly are interested in, that you attend the social. A lot of times they'll list it as optional, or, if you can't make the social, it's okay. That doesn't mean they're not going to rank you,
I mean,
but
it pretty much always is optional. Like the programs understand that you're traveling, you're a full-time dental student. But yes, especially if it's a program you're interested in or you want to learn more about, you should really try to make it.
yeah, like Maddie said, that is for you as the applicant, probably the best time that you're going to get an idea and a feel of if you would fit into the program, just from the culture of the program perspective. So I would urge people to go to the social for a number of reasons, but I think there's maybe one or two times where I just couldn't because I was trying to make another interview or something.
After you attend all of your interviews, there will be a portal eventually where you rank all of the places that you interviewed at. Are you allowed to omit a place that you say you really don't want to match there? Can you just leave them off that list entirely?
Yes. Yeah, you can not rank places. If there's absolutely no way that you would ever want to go there for any reason, then you can just not rank them. But if you're doing that, then there's no chance that you've ever matched there. So you just have to be sure. I think I didn't rank two places. Like people do it, for whatever reason. Like if you didn't realize something about the program when you went to the interview and then you're like, oh, like I didn't want that, that's fine, I'll just pass. You can do it for a variety of reasons.
And just to rewind, so can you explain a little bit about the rank? Because this is very different. Like going through this ranking process, it's very different from applying for college, applying for dental school.
Yes.
Can you explain a little bit what we're talking about when we say rank?
Yes. So match it's an algorithm. And it's the same algorithm that the medical folks use. So when you hear like med students matching into residency, that's what you're doing. So there's two sides of it. There's the applicant side and then there's the program side. the applicant makes their rank list. So you'll seriously go in and say like 1, 2, 3, 4, and rank the programs in the order that you would want to go there. And then the programs do the same thing, and they make their list of 1, 2, 3, 4, like all the way down the list of who they want. And then this mystical like match algorithm puts it together, and it somehow favors what the applicant wants over what the program wants. And then based on how things are going, it kind of edits it. There's a really good cartoon, if you're interested in how the match works, on the match algorithm website that explains like if person A matches program A this way, that type of thing. But yeah.
Yeah. But it really is in the applicant's favor. People freak out about it. We all do. We all freak out about it. But it's nothing that you should waste your energy worrying about.
Yeah, I think people are like, what is the
trying to cheat the
strategy?
system,
Well, what's
yeah.
the strategy? Okay, well, I know that program really likes this person, so I'm not going to put really just rank the order of in the order of how you want to go to those programs. So if you want to go to that program the most, put them first, and then that program second. There should be no like games or strategy other than just put it in the order of where you want to go first to last. And then, like you said, omit as necessary.
Where I feel like I see things going poorly, like when it goes bad and somebody doesn't match, it's because they tried to play the game and they're trying to make inferences on this program definitely didn't like me, or they liked her more than me, so I'm going to make sure that I, put them number 2 because I think she's putting them number 1. You just can't do any of that.
No.
Just don't try to play the game.
No.
It's not going to work. You just have to sit down and make your list in the order that you would want to go to. And the chance of you matching within your top 3 is exceptionally high.
When I was interviewing, one resident at a program that I was visiting, he was like, yeah, you guys all stress out, but if you think about it, like he was like, how many interviews are you going on? How many interviews? And what I said 10, and then the other guy said 10. And he was like, and if you look around, how many of there are you today? And they were like, only 10 of us. And he was like, if you really like look at the numbers, there really is, for the most part, it's pretty equal. There's a place for everybody. It may not equal out where it was your number 1 or your number 2. Of course, people go unmatched. Of course that happens. Like it's never going to be perfect. And of course there are extremely reputable programs where they have unmatched spots and you're like, how is that possible? Yeah. But I mean, minus those little outliers, it does work out.
Mm-hmm. Yeah.
And there is always post-match.
Yeah.
So I know loads of people that post-match into their program.
And then Maddie, for the process, so you go through your rank. But another question we get is, after you finish going to all of your interviews, if there's a program, let's say, that you're very interested in, or certain programs that you're interested in, would you recommend these applicants to reach out to the program or send a thank you or anything along those lines? What are your thoughts on that?
So that can be kind of tricky. Our chair, or our previous chair, for example, at the last few interviews that I've been to as a resident, he very clearly says, I'm not gonna you don't need to send a thank you email, basically, we're not gonna respond. So, and part of the reason why some places are careful about it is because there are rules, associated with the match. You can't correspond after and be like, hey, just so you know, we're putting you number 1. You're not supposed to do that. So there are rules. So kind of keeping that in mind, I feel is important. But I feel if you connected with somebody in particular, or if you connected with the residents and you want to send just a quick thank you, I think, go for it. I did for some of my top programs. Do I think it's going to make a big difference? No. I do know that there are some programs where after interviews, if you were blown away by somewhere that you didn't have an opportunity to extern at, they might be amicable for you coming out for a few days or the weekends or just like coming and checking it out and spending time with them. I think if they're going to allow that and you're really into a place, that's probably a good move if you haven't been there in person.
At one of the programs I went to, one of the applicants, I was talking to him and he was like, I really like it here and I really want to come here. I think I didn't extern here. I'm going to come back and do an externship. And I think he did do an externship and he did match there.
Oh,
Yeah,
nice.
he did.
Yeah, I know someone who did it too.
Ooh, pro tip.
Yeah. So it does
then-
happen.
So then after you come up with a rank, so you submit your rank list, and there's a date that you need to do this by, correct? Which is around
Oh yeah, you certify your
December,
list.
early January.
Yeah,
Yeah, you.
end of December, like right before Christmas, I think is normally around
Yeah.
what it is. It's like late December, early January. You submit your list and you say, I can't change it anymore. Here it is. And then programs have a similar deadline, and then the algorithm does its thing. And then normally it's like the third Monday in January or something like that, or the third Wednesday. You get an email from the match service that says, congratulations, you've matched at XYZ, or so sorry, you haven't matched.
Well, ours on the West Coast, it was like at 5 a.m.
It's really early.
Yeah, so we would like wake up really
Everyone would
early
wake
and
up.
sit by the computer and freak
Yeah,
out.
and I think everyone, like you said, it's on a Monday. We all just took that day off. Like, we
I
didn't schedule
can't-
patients.
I can't. I hate opening things like that. I hate checking my score. So I had to have my dad and my mom and dad came and they flew out. It was so sweet. And
Oh, yeah.
they flew out and my dad opened the email for me
That's
because
so
I was like,
nice.
I can't do it. And the way that it was, because it was LAC but he thought it said like a different program, like because of he's like, what's a LAC? Like he was
Yeah.
really confused. And so he didn't say anything for a long
Oh, I
time.
forgot
There was like a
about that.
really long, like he was like, huh, and it was like, he wasn't like, you matched. So I was like,
A panic
oh my God, this is so sad. And then he was like, what is a LAC? I'm like, it says it there, Dad. I'm like, yelling, it says USC. Yeah, like,
I forgot about that.
it was like, he didn't say anything for a long time. I'm like, oh my God, I didn't match.
That's a stressful time. But
I
then
should have just opened it myself.
it's like a stressful moment followed by immediate, like the most relief.
Russia.
Yeah, the rush of relief. But
Yeah.
But yeah, so that's the match program, match
That's
process.
it. That's the application process.
Yeah.
Yeah.
I guess so for people who do not match, like let's say they do get that email that says, unfortunately, you did not match. What are the next steps that you would recommend for these applicants?
I mentioned all the rules that have to do with the match process. Once that match is done, it's like the Wild West. So now there's no rules. Yeah, there's no
just
rules.
make
There's no
calls.
dates. People are, you can get the list of the unmatched spots, like we were talking about earlier, spots that the match program could not find somebody to put in. So now the program has empty seats, and then there's also non-cat spots that you can apply for. So people are kind of spamming out their application to these programs that they're interested in if they have no match spots, or spamming out their application to people that have non-cat spots they might be interested in. Sometimes, if you have good relationships with attendings or mentors, they might be able to help, like make a phone call and just be like, hey, she didn't match and she's really great. You should consider her. And things start to fill from there. And it's kind of first come, first serve. If they find an appropriate candidate that they are interested in, they can like seal the deal. There's no date that they have to wait for at that time.
Yeah, it's really, you figure out where there are no spots, or you figure out where there are spots that went unmatched. You try to contact that program ASAP.
Mm-hmm.
You try to pull whatever strings you have, whatever connections you have to get phone calls, to get communication, and then if you can't match, post-match is what they call it, then you start going for the non-cap positions.
Is there a website where these spots are listed immediately afterward?
So I think that there is an email. If you do not match, you get an email with the seats and the programs where they are available. And then normally somebody puts that on SDN is what I've seen.
SDN.
Yeah.
SDN is still going strong.
Yeah, it
Wow.
is. Yeah.
I would recommend for people who are going through that process before the match comes out, if you have any inkling that you may need to go through that process, like let's say you only got a couple interviews and you're not, you don't know if you're going to match. I think it's very important to get all of your materials ready before that email comes out because, like Maddie said, it is a friggin' free for all. So, if it is in your best interest, if you're the first person that reaches out to a program for a post match spot, and then that, let's say, program director from that program can quickly like text the attending at your program and confirm
Yeah,
that you're
'cause
a
they're
good.
all friends.
Yeah, they're all friends. They all know each other.
Yeah.
And you might secure that spot simply because you were the first person to come through the door before other people. Because if you think about it, the program also is a bit desperate. Like you're desperate for
they're
a
scrambling
spot,
too.
but that program is also desperate for a spot. So they don't want you to reach out and they're like, let me see if this is a good candidate, and then potentially lose out on you taking that post match spot because you went to a different program and got a different post match spot. And then they're kind of floundering for someone else to reach out to them. So it's kind of a little bit on both ends. So the sooner that you can reach out to these programs, the better, which means you have to be prepared with your materials, which you should have because you applied.
If anyone has any questions about this application process or just the application process in general, I highly encourage you to reach out to residents that you know. Maddie, you have a platform where you discuss all of these things. Where can our listeners find you on social media?
Yeah, so I have a TikTok and I have Instagram. The handle's the same for both. It's MaxFace Mads. And then I have a YouTube channel that I'm very slowly trying to build as well with some longer format stuff. Since so much of this is so detailed and overwhelming, it just takes some longer
Super
videos.
detailed. We can talk for hours on
Yeah.
this, like the CBSE. So
Yeah, we like barely got into it, but I do think that your YouTube platform and what you're building right now will be incredibly valuable for people that are applying because it sounds like it's going to even go into even more detail than what we discussed today. And again, we can talk for hours about this, but I think at the end of the day, if you're going through this process, you're applying, it is important for you to find upperclassmen, people that have gone through it, like Maddie, to get advice. Like you can't go through this process blind or alone. And so our goal here today is just to kind of give you more information and more resources to get you through this process. So thank you so much for joining us today, Maddie.
Yeah, thank you so much for having me. It was so fun.
Really helpful. Thank you.
thank you.